Hello everyone, we warmly welcome you all to our special program brought to you by Indian Achievers Forum. I'm your host Vatika Singh. Indian Achievers Award is an honor that celebrates the people who went extraordinary to effectuate their aspirations and ideas. In this series, we emphasize not only on the struggles and achievements of the people, but also on the social contributions they made to their native land, India. Before introducing you all to our one such achiever, let's take a look at the small AV.
Indian Achievers Forum is driven by a full-fledged advisory board. The board consists of experienced personalities who have excelled in their respective careers. Together, the forum organizes conferences, events, workshops, exhibitions, trade shows, and B2B initiatives in India as well as abroad. Where there is passion, there is achievement. And where there is achievement, there is Indian Achievers Forum.
Today we have with us Dr. Vinod Patchigalla, who is the Chief Operating Officer of Star Care Hospitals, Oman. Hello sir, how are you?
Hi, Vatika. I'm very well. How about you?
I'm also good too, sir. Okay, so before entering into the questions, tell us something about yourself and your professional role.
I'm basically from a small town called Rapur, which is in Nellore district, Andhra Pradesh. My parents, Ratnam and Mary. My father is a small contractor and local politician in my town, and my mother is a central government employee. I started my schooling in Rapur in government school, and then moved to Nellore for my intermediate, I mean +2. And then I got an opportunity to study in Guntur in GVR&S college. I did my graduation there and then moved to Hyderabad for post graduation, that is master's degree in hospital administration. When I was in dilemma after my graduation, it was my uncle Mr. Rajaratnam who guided me to take up the course of hospital management. I still remember those discussions and all in my family. I completed my post graduation in Osmania University under Deccan College of Hospital Management, and then I started working with global hospitals. Global hospitals in Hyderabad. We had two branches during that time, and I was in Lekrigapul branch. And I had an opportunity to work with Dr. Rajshekhar, who is the CEO of Anglo-Arabian Healthcare right now. And it was great learning experience for me, and it led a strong base for my professional career. And I still share a lot of ideas and discussions with him. It was really a fantastic opportunity for me to turn up my career in healthcare industry. And then I moved to Watson Healthcare, where I had an opportunity to manage branches, I mean, healthcare. Then I moved to Watson Healthcare Private Limited, where I had an opportunity to manage the eye care hospitals independently. There, I started learning about P&L and managing the doctors, branches, all that. I should say thanks to Mr. CHKS Prasad, who had given me an opportunity, and the chairman, late Sri Dr. Arun. And then I happened to meet Dr. Bhaskar Rao, the chairman of Krishna Institute of Medical Sciences in Hyderabad. And then I started working with his son, Dr. Abhinay, and we started a branch in Kondapur. It is a 200-bedded hospital, and now it is running successfully. And Dr. Abhinay had given me a lot of opportunities, and I had learned a lot of things from him. I was really lucky to have such a boss during that time in Krishna Institute of Medical Sciences. And then I had an opportunity to interact with some of the healthcare leaders in Hyderabad. Few of them are Mr. Sudhakar Jadhav, who is Chief Operating Officer of Oasis Group now. And then Dr. Riaz Khan, who is the CEO of Continental Hospitals right now. I happened to meet Sudhakar Jadhav, and I said I'm looking for better opportunity. And then He introduced me to Dr. Riaz, and Dr. Riaz introduced me to the chairman and managing director of Kerala Institute of Medical Sciences, Dr. M.I. Sahadullah. And when I met him, I was very excited to work with him, and I got an opportunity to work with him. And Dr. Sahadullah had given me a new acquired hospital in Hyderabad. I proved myself in that, and then he asked me to take up a new assignment in Saudi Arabia, and that's how I entered Gulf. I was with I was with Kims in Saudi Arabia for almost 3 years, and then I moved to Bahrain. I worked there for 1 year. During this journey, I must say about Dr. Sharif Sahadullah, who is son of M.I. Sahadullah, a great gentleman and wonderful boss, I would say, and he is very cool and very professional. I have learned a lot of things from him. I must say thanks to him and Dr. M.I. Saudullah for giving me an opportunity to work in Gulf. And then I happened to move to Starcare group of hospitals for next level of career. And I had an opportunity to work with Dr. Sadiq, who is the chairman here, and Mr. Nasir, great human beings and wonderful leaders. And I'm still happy and working here in a Starcare group of hospitals. And this is just a brief introduction about me and my professional career.
That's really great, sir. Okay, so moving ahead, I'm very keen to know that how did you reach this level in your career? I mean, what was the journey that led you till here? And other than that, who all are the people that you owe your success to?
I must say there are a lot of ups and downs in my personal and professional lives, but there are a lot of people who helped me to grow in my career, and there are a lot of people who help me to be happy in my life. I must say, first and foremost, they are my parents. They have given me a great comfort, great freedom to choose my studies and choose my careers as well. And they are really wonderful parents. I'm really lucky to have such parents in my life. And then I must say, my teachers who taught me to grow well. So I'm not a great student, but they made me to learn, and they have given me enough opportunity. And then my teachers, even though I'm not a great student, but they have given me enough opportunities to learn and become a good student actually. And then, as I said before, there are certain people in my professional life that I must owe to them. They are Dr. Rashekar in Global Hospitals, and Dr. Abhinay in Krishna Institute of Medical Sciences, and then Dr. M.I. Sahadullah, Dr. Sharif Sahadullah. I remember them in my entire life, and I will definitely work with them if I get opportunity to. They have a special place in my heart, and I remember them in my life. And then I should say, last but not least, about my life partner Shanti George, and she is a great support to me. When I finished my studies and started my career, I got busy, and then I used to go early and come late nights. She's a wonderful partner to understand and take care of my kids and all. And also, when I started studying specialized courses, like I did GOQM, Lean Six Sigma Black Belt, and then a course in Harvard University. Now I'm doing fellowship in American College of Healthcare Executives. So there is a lot of support from my wife on completing these courses, because when I reach home, I had to study and I had to spend some time on my courses, and I'm not able to do anything for home. I must say my wife is taking care of these all home related things in my life.
It's really wonderful to know, sir, that there are so many supportive people around you, and that really motivates you to work ahead. All right, so moving ahead, we know for a fact that starting anything has never been easy for anyone. So, what all were the challenges that you had to go through initially during your professional journey?
Yeah, when I completed my post graduation, I was in hunt of dissertation. Getting a hospital to complete my dissertation was my first challenge, I must say. I just passed out with some second grade marks, and I happened to meet many people in different hospitals, but I could not get my dissertation. That was my first challenge when I completed my studies. Then, luckily, through some sources, through some connections, I got an opportunity to complete my dissertation in global hospitals. I must say thanks to Mr. CHKS Prasad and Dr. GVJ Prabhakar for accepting my dissertation there, and Dr. Ravindranath, of course, the chairman and managing director of global hospitals. And then when I started working, I was very new. I do not know anything about hospital, or I mean, I know, but it is very new to me to work in a hospital. And it took some time for me to understand the processes, policies of the hospitals, and interact with the people. So I took it as a challenge to get along with the processes and policies there in global hospitals and become one of the trusted employee later. But the biggest challenge comes when you are growing. When you are growing, you need to take up additional responsibilities. You need to manage different kind of people, different groups, and different issues. So it's a learning process. You have to learn and you have to implement whatever you have learned. So these are the challenges I had in global hospital. And then when I was moving from one job to another job, so I felt like uh, the policies and processes are completely different, especially in India and Saudi Arabia, and then Saudi Arabia to Bahrain, Bahrain to Oman. Every country has their own set of rules and regulations and guidelines. So that took some time for me to understand and adopt the local policies and processes. And apart from that, I must say the biggest
All right, sir. So moving ahead, since you're a part of the healthcare industry, so where do you see Indian healthcare system in the next 10 years?
Vatika, everyone felt we had a strong healthcare system before COVID, but COVID had taught a lot of lessons to us. But looking at our healthcare system right now, we have only 0.07 doctors per thousand population, which is very low. It is lesser than Pakistan and Bangladesh as well. So the need of the hour is to improve our number of the doctors in the country, and then we should also start implementing some new strategies like NABH accreditation should be mandatory to all the government hospitals. That will definitely improve the quality of the services in government hospitals. And we should also involve healthcare professionals to run government hospitals like how they are running in private hospitals. And we should also start looking at PPP model. PPP is public private partnership model. And also we can look at O&M, like we have some hospitals, they outsource their management and marketing services, that is O&M, operations and marketing. There are different opportunities to improve our government hospitals up to the level of corporate hospitals. So in the next 10 years, I must say, I think one of these strategies may be adopted by the government, and I'm sure the government will take precautionary measures to face pandemics like COVID, at the same time strengthen our healthcare systems in India. And I should also say that we should look at improving or increasing the number of hospitals in rural areas, so that the urban areas will not have that a huge crowd coming at one time and then creating issues for everyone.
Right, sir. Okay, so needless to say, the world is going through a global pandemic. Like we are under the wake of COVID-19. So, since you are connected with the healthcare industry, so how could we have managed it better, or how can we in the coming future can manage it better?
I had experienced COVID pandemic under my leadership itself in the existing hospital. So what we have done is, as soon as we hit by the first wave in the last year, we had taken all the measurements to increase the bed strength, increase the staff, and then vaccinate our healthcare staff and all that in my existing hospital. But in India, what I heard observed, after first wave, still we haven't prepared for the next pandemic or next wave. And that's why, if you see, we had exported, imported. If you look at India, when we had hit by first COVID pandemic, we haven't still learned lessons from it, and we were not ready to face the next wave. And that's the reason we had registered highest number of COVID cases and deaths in the second wave. So we could have vaccinated all the population when we hit by the first wave. We could not do it. In fact, even though we had the vaccines with us, we exported, treating COVID very light, and then we were our preparedness was really weak. And looking at the present scenario, in the future, I think we should use technology to handle COVIDs other than vaccinating people. Technology in the sense digitalizing the services, like we have telemedicine, we have teleconsultations that are already existed. Apart from that, we can have virtual hospitals or virtual ICUs or virtual home care, where you can have one control station, and then it will be connected to different locations where you can see the patient parameters, and then that parameters will be displayed in this control system, managed by the doctor, and one doctor can manage 3 to 4 sub virtual. So what I must say, in the next 10 years, I think we are going to utilize technology a lot. Technology in the sense, we already have teleconsultation and telemedicine. Apart from that, we should focus little more on implementing AI or technology or digitalization of hospital services. Like, you can digitalize your consultation, like video consultation and all, and then you can get your prescription or investigation through video consultation, where you don't need to meet any doctor there. At the same time, you can look at inpatient services as well, where you need home care for certain cases, like post-operative cases or bedridden cases or elderly care, geriatric care. All such kind of patients can be treated at home itself without bringing them to hospital by using the technology. So there are organizations that are setting up virtual ICUs or virtual home care, where you can see the parameters or from home to the control system that is monitored by the doctor, so that they don't need to meet each other. At the same time, the doctor can monitor and get updates on regular basis. So these virtual cares and virtual home care should be encouraged in our India. At the same time, we should also think of implementing them in public and private sector, where you can have a control system in one place, and that can be connected to sub control systems located in different locations, so that doctors, or they don't need to visit the patients physically. At the same time, patients don't need to come to hospitals and get infected. So I must say, in the next 10 years, or to manage this COVID in a much better way, we should adopt technology, and then start utilizing digitalization of services. At the same time, implementing virtual inpatient cares and virtual home care.
All right, sir. So, since you know that we all have certain plans for our future, so what are your future plans with respect to your career? And since you know that IF is followed not only by mainstream organizations but also those young minds who aspire to be like our achievers someday, what message would you like to give them?
Vatika, I think do a lot more years. So I want to work few more years in Gulf, and achieve a status where I don't need anybody's help to manage healthcare institutions. And then I have a plan to start my own healthcare institution in India, with a unique concept that I cannot reveal you right now. But it will take 4 to 5 years time for me to get into entrepreneurship. And message to younger generations, I think they are very smart and they're much forward than us. When we were youngsters, we were not that good in using technology, but it looks like the youngsters are very fast in learning, and they're very smart in utilizing the technology as well. But with my experience, I must say they should look at short term and long term goals, and then have a network, start building up network, and then when they get job, look for more responsibilities, and then take the feedbacks seriously, so that they can correct themselves and adapt to new processes, new policies, new technologies, and then master themselves in the studies, and then in the new strategies, and also try to help as much as you can to the juniors. At the same time, admire good qualities in the seniors. So I must say only one thing: don't run behind the money, but just run behind the work, and the work will bring you the money.
And that, I must say, sir, is a great piece of advice. Thank you so much for joining with us today. It was pleasure talking to you, and we hope that you continue to inspire people of all ages forever. Thank you so much, sir.
Thank you so much, Vatika. I would like to thank Indian Achievers Forum as well for giving me the opportunity to share my thoughts in public platform. I wish good luck to the same time IAF to continue to recognize leaders and inspire the younger generations as well.